Imagine waking up every day not knowing where you'll sleep or how you'll feed your children, or if today will bring another relapse. This is the reality for too many adults in Montgomery County who struggle with chronic chemical dependency. But there is a solution. The Montgomery County Recovery Continuum Program, or MCRCP, combines proven medical treatment with stable recovery housing. Together, these two services can break the cycle of relapse, stabilize families, and strengthen our community. My name is Sarah O'Neill, and I'm presenting this program as part of my Capstone in Human Services. The mission of the Montgomery County Recovery Continuum Program is to reduce the number of adults suffering from chronic chemical dependency who are left behind by fragmented and underfunded behavioral health services. Our program coordinates medication-assisted treatment with recovery housing. These two approaches, when combined, give individuals not just treatment, but also the stability they need to succeed in long-term recovery. In Montgomery County, chemical dependency is one of our most serious public health concerns. Adults over the age of 22 are consistently identified in treatment admissions records, probation reports, and community health assessments. The ratio of residents to behavioral health providers is an alarming 851 to 1. Many residents are uninsured, underinsured, or financially unstable. Family systems are destabilized, children are neglected, and courts and emergency rooms are overwhelmed. Although programs exist, they're fragmented and underfunded. Without a coordinated continuum of care, relapse is common. Justice involvement is frequent, and the cycle just continues. That is why this program is not just needed, it's essential. The Montgomery County Recovery Continuum Program uses an integrated strategy. First, we establish partnerships with local healthcare providers, courts, and community organizations. Second, we provide medication-assisted treatment combined with recovery housing to stabilize individuals and promote accountability. Third, we incorporate peer recovery coaches to walk alongside participants, reduce stigmas, and provide them with encouragement that otherwise they wouldn't get. Fourth, we use case managers to remove barriers such as lack of transportation, unemployment. A lot of these people have restrictive abilities to gain employment and untreated mental health needs. And finally, we commit to continuous evaluation and quality improvement so that they're connected and the program adapts to meet community needs. This approach ensures that people are not just treated, but they're truly supported. Our objectives are clear and they're measurable. 70% of participants will sustain medication-assisted treatment for at least 90 days within the first year. 60% of participants will secure recovery housing for 6 consecutive months. 65% of participants will report stronger family and social support. By year 2, relapse and justice system involvement will be reduced by 30% compared to baseline data. And 75% of participants will report reduced barriers to treatment, such as transportation, affordability, or wait times, within 60 days of enrollment. Each of these objectives directly addresses the biggest obstacles faced by our community. To implement this program, we require an annual budget of approximately $661,000. This covers professional staffing, recovery housing, coordination, operations, and outreach. We have developed a diversified funding plan that includes multiple streams of income, federal grants through SAMHSA, state funding from the Indiana Criminal Justice Institute, local support from the Franciscan Health Foundation in Crawfordsville, corporate sponsorships through Wabash National, and community-driven fundraising through GoFundMe and faith-based partnerships. By combining these resources, the program is financially sustainable and supported by the very community that it serves. Why this matters? The impact of MCRCP will be immediate and measurable. In the first year, relapse-related emergency department visits will drop by 25%. 60% of participants will maintain stable recovery housing for at least 6 months. At least 65% will report improved families' trust and social support. And by the end of year 2, justice and system involvement will be reduced by 30%. This program doesn't just save money, it saves lives, it strengthens families, and it restores dignity to people who have been forgotten. In closing, the Montgomery County Recovery Continuum Program is ready to launch. It is evidence-based, rooted in community needs, and supported by a realistic funding plan. But most importantly, it provides hope. Hope for parents who want to reunite with their children, hope for individuals who want freedom from relapse, and hope from a community that wants to be healthier, safer, and stronger. As agency director, I respectfully ask you to support in improving this program. Together we can close the gap, restore stability, and build a recovery system that truly works for Montgomery County. Thank you for your time and consideration.